Okay, everybody, we're about that time. Sorry, we're about a minute late here. My name is John Bernstrom. I am the Public Information Officer for the City of Grand Forks. I will be the moderator for this virtual press conference. It's new to us. We're taking a shot at it. We'll see how this works. We will have statements from Mayor Brown, Todd Phelan, our City Administrator, Deb Swanson, our Director of Public Health, and I believe we have Dr. Deer on from All True Health System. They will give statements to start and comments, and then we will open it up for Q&A. For those of you not familiar with Zoom, there is a hand raise option where I'll be able to see if your hand is up and wanting to ask a question. I will then unmute, for the media, I will then unmute your mic and you can ask your question. I see everyone seems to be pretty well identified, so I will be able to give out the call letters or whoever's raising their hand. For those that are potentially joining by phone, I don't see any, but if they join later, I will, after the video questions are done, I will then reach out to anyone on phone who's not able to raise their hand virtually within this Zoom conferencing and ask if there's any questions there. So I'd like to start first off with Mayor. I'm about to pull you up here. Ladies and gentlemen, Mayor Brown.
Well, good afternoon, and thank you for joining. Our job in city government continues to be protect and serve. And there are moments you'll remember for the rest of your life. You'll remember what was going on, how you responded, and how it made you feel. There are moments you'll regret and moments you'll be proud of. I'm asking all of our residents to make this a moment you will be proud of, when you made the right choice, the hard choice, the smart choice. We are aware that additional cases of COVID-19 have been identified in the state of North Dakota just today. We've been in conversation with Lieutenant Governor Brent Sanford and cities across North Dakota regarding congregation at bars and restaurants. Governor Berger will be holding his press conference at 4 p.m. this afternoon, and we anticipate he will speak on this matter. We're so thankful to have partners like Governor Berger's administration and cities across North Dakota as we work to protect our communities in these extraordinary times. I, as mayor, am proud and prepared to act in the best interest of the citizens of Grand Forks if necessary. Social distancing is the one tactic that gives our community members, especially the immunocompromised and the elderly, the best chance to stay healthy. While most of us can walk around the community unaware of being contagious, it is the population with compromised immune systems that will bear the ramifications. It's about someone's dad, someone's grandpa. It's about a young child with a condition that makes them more vulnerable. A little girl and her family have already powered through so much. Families have already stepped up. It's our turn to support them. We understand there'll probably be an extended time we'll be under these extraordinary circumstances. We also understand even 1 or 2 days of early action can reduce the impact by dozens, if not hundreds, of infected carriers in our community. The chance to act boldly comes along only so often. This is the time. This is the right thing to do, and I urge all community members to heed this call, support their neighbors, and protect their community. Make no doubt, you'll remember this time, and you will remember the choices you make. I know I will. We are in this together. We will get through this together. We in Grand Forks community are well positioned because of the current implemented mitigation steps to lessen the effect of COVID-19 in our community. By taking the precautionary measures in place, we can and will flatten the curve of this virus. All of us need to take personal responsibility and practice social distancing, frequent hand washing, sanitize frequently used surfaces, and practice good hygiene to mitigate the spread of COVID-19 in the Grand Forks region. This is a tough time for our local businesses. I urge you to support them by ordering food for delivery or pickup. Local businesses are stepping up in a huge way by making meals for school-age youth while they're not physically in school. Many of them are adapting their business models to accommodate these unique times by shifting towards takeout and delivery services to deliver their products to you. They are a part of what makes this place, Grand Forks, special, and I strongly encourage citizens to support them in these difficult times. I want to assure everyone that the essential services like police, fire, PSAP, and public works and waterworks operations are continuing. City staff is taking necessary cautions to ensure the essential functions continue with the utmost care and caution. In addition, the cities continue to execute the flood action fight in light of the situation and will be prepared for all circumstances. City-owned buildings have been closed to the general public with the exception of unique circumstances. Staff is working remotely when at all possible, and we've reduced shifts down to a minimum necessary staffing. We have set up a virtual city hall at grandforksgov.com/virtual, where you can complete basic city business like filling out applications, paying utility bills, and applying for permits. We are canceling the committee of the whole meetings for the time being and will forward all pertinent items to the city council. We are committed to ensuring public participation as possible remotely by phone and video. More details will come later. We are aware that several utilities have done what the city of Grand Forks has done, as far as not performing utility shutoffs or imposing late fees. At this time, we would like to also call on landlords to be lenient with their renters. I applaud our grocery and household goods suppliers who continue to provide goods and services, and also who are regularly providing updates on their operation in order to keep our community informed. We are coordinating some of this effort about food utilities on our website in an effort to support businesses and nonprofits in communicating accurately and timely to the public. These are extraordinary times. Together, individual decisions to stay home when at all possible, practice social distancing, limit gatherings to fewer than 10, washing hands frequently, and sanitizing services will benefit all of us in the long term. These steps are not for anyone individually, but for all of us collectively. The virus has the potential to severely affect the most vulnerable among us, like the elderly and those with pre-existing conditions. These are our friends, our neighbors, and our loved ones. So do it for them. I also want to thank the businesses that have responded proactively by shutting down their businesses in this extenuating circumstances. And there are several other administrative actions we have taken, and this time I'll turn it over to City Administrator Todd Phelan. Mr. Phelan.
Excuse me, Todd, we'll get your mic up in 1 second. Hold on. I'm going to mute Mayor Brown and we'll get to Mr. Todd Phelan. Hold on, Todd. Todd, there you go.
John, can you hear me?
Yes, we have you, Todd.
All right. Thank you, Mayor Brown, for your message. Really, from a City of Grand Forks perspective, we're carrying out the mayor's wishes from an administrative perspective. We have been holding meetings on a daily basis, trying to get those messages out. And so, as the mayor says, our first role here with the City of Grand Forks is to protect and serve. And the citizens of Grand Forks should know that we have been working really hard on a day-to-day basis. I know Debbie is going to speak on behalf of Public Health next, but thank you to the Public Health Department. She will provide that situational update. We also have been coordinating with our county through emergency management so that we're synchronized with what the City of Grand Forks is doing and with what Grand Forks County is doing. Importantly, as part of protecting and serving, we've been having ongoing meetings with our public safety agencies, whether it's police, fire, public safety at Century Point, public works, waterworks, public transportation, along with our city health departments. And even though we really are at essential services, essential personnel, and essential spending, we are still carrying out our mission. And we know that with this coronavirus challenge we have in front of us, this is going to take some time and some effort. We are also leaning into a challenging flood coming in the next week or two. And so we're trying to preserve as many resources through this initial coronavirus challenging matter they have, leading in with our really essential crews working on flood protection. And so our effort is to save ourselves for the longer term. The citizens of Grand Forks should be very proud of their essential services, those personnel that are carrying out those services, and the commitment they have to the citizens of Grand Forks and the want to really come through on behalf of their community. So all those services that sometimes we take for granted we are paying a significant mind to make sure that we can perform not only in the short term, but the mid and long term. As the mayor spoke, we know as we try to flatten this curve on this issue, there will be concerns regarding long-term business. And so we are focused not only in the present, but looking at the future of how do we engage with the business community and moving forward as this event hopefully begins to wane sooner rather than later. And so we will be engaging with the public in general, the business community as we move forward. Much to be done. The citizens of Grand Forks should know on behalf of Mayor Brown and the City Council that we're working essential services day to day, and things are adapting moment to moment sometimes, and at least day to day. So, with that, John, I think that's a summary of what we're doing today.
Thank you, Todd. Next up to speak, I have Deb Swanson. I'm going to swap around my microphones, and Deb, I will get you pulled up here. Deb Swanson from Grand Forks Public Health. Go ahead, Deb.
Good afternoon, members of the media and residents of Grand Forks County who are watching us today. As mentioned, I'm Debbie Swanson with the Grand Forks Public Health Department, and we represent both the city and the county of Grand Forks. And it is our responsibility to ensure the health and safety of all residents in our region. We know that people are being asked to react rather quickly to all of the recommendations that have been mentioned and that we are asking of the public. But what we can tell you is that those actions are critical to stopping the spread of coronavirus and preventing the disease of COVID-19, something you've been hearing a lot about lately. We greatly appreciate your assistance in following all of these recommendations. Today, we met with our community partners, schools, community agencies, healthcare providers, universities, Grand Forks Air Force Base, and many others, including our regional public health partners. And we are so proud of the work that everyone is doing to come together, to follow recommendations, to stay on top of all the communication that's necessary to keep all of our residents safe and healthy during these unprecedented times. We have a number of tools that are available to you to help you stay in touch with us, including a newly established email messaging. It's gfhealth@grandforksgov.com. You can send your questions there and they will be answered by one of the members of our public health staff. We also still maintain a presence virtually, even though we don't have people here in the office. We have staff members ready to respond to most any need, and that is available through our regular telephone number, 787-8101. I can't stress enough how much we appreciate hearing your concerns and being able to answer them so that you can all keep your individual groups, families, businesses healthy and safe during this time. As a situational update, I just wanted to remind everyone that also you can find information on the North Dakota Department of Health website. It's at health.nd.gov. All of the news releases regarding cases are posted there, as well as up-to-date information. So far, 508 people have been tested for the coronavirus, and 15 cases have identified as being positive. They are located in Ward County, Morton County, Burleigh County, and Cass County. We feel that as a population center in North Dakota, it will just be a matter of time before we have cases here in our region. We will do our best to ensure that you have up-to-date information about that and how to continue protection. We are grateful for the resources of our community and especially our partners at All True Health System. They have stepped up in huge ways to test large numbers of people, to care for people who are presenting with symptoms, to ensure the health and safety of all their healthcare workers. And they have done a tremendous job of making things flexible and available to our community residents. So I'd like to hand off at this time to Dr. Josh Deere, who will tell you a little bit more about All True's efforts here in Grand Forks and also throughout the region. Thank you.
Thank you, Deb. And before you get going there, Josh, let me get you switched over to get your microphone on and get you flipped on. Bear with me here 1 second. And Dr. Deere.
All right, thank you, John. I'd just like to thank Debbie, Todd, and Mayor Brown for the words that they spoke before me. I really think that we're all step in step with the same unified community and regional goals. I really think as community members and All True Health System as a nonprofit organization, our goals are the same. We ask everyone to be personally and socially responsible to keep ourselves safe, along with members of our community. I really would like to highlight, as Debbie did, relying on the cdc.gov. They have an excellent link on Corona, as well as the North Dakota Department of Health website, as kind of North Stars for us as we look and sift through the data of what coronavirus really is. What we're doing at All True is we're responding as quickly and swiftly with patient and community safety at the center of any decision. We opened our coronavirus hotline, COVID-19 hotline, on March 12th. Since then, we've screened over 1,000 plus calls, with our peak day being 431 calls yesterday. With that, we've done curbside testing on greater than 160 patients as of this morning, with ongoing screenings today. This is operational 24/7. The importance of this hotline is essential to keep our ERs from being flooded with worried patients, and understandably so. They need to be in contact with healthcare providers so we can keep our essential services open for the general population that is going to continue to have illness as we go through this COVID outbreak. Other things we're doing from a health system perspective is we're limiting visitors to one. This is not an easy decision to make from a health system perspective. We understand the importance of including family in all decisions we make with the patients, but for the safety of our patients, our staff, and the rest of the community, we think that this is another step to mitigate spread. We're going to be increasing our virtual spread for medicine as the federal government has relaxed some of the regulations as it relates to this, because we realize that we are going to see an uptick with social isolation, anxiety, and other conditions. We want to be able to serve the public and get them the care that they need in times like this. We're working around the clock with both our hotline and our 24/7 command center, with emails coming in daily from employees. We're most importantly working closely with the North Dakota Department of Health, and as everyone on this panel can attest to, we're really changing hour by hour what we're doing. We're listening to them for guidance, and we're following them step in step. Dr. Burgum's released many excellent updates, particularly the most recent one being at 11 today. And I'd like the community to really use that as a resource. Again, thanks for this forum, John. This highlights things that we can do. We're doing a Zoom meeting. No one's within 6 feet of each other. We're virtual, and this is exactly what we're being asked to do from a government standpoint. All of the things that you've already heard, washing your hands, covering your mouth, social distancing, groups less than 10, social quarantine, that's what we need to do to flatten the spread. And thanks again for having us here today, John.
Thank you, Dr. Deere. At this time, I will open this up to questions. Please, from the media, please raise your hand. I will call on you and unmute your mic and let us know who you'd like to talk to. As I'm taking a look at the screen, I don't. At this time, I will open this up to questions. Please, from the media, please raise your hand. I will call on you and unmute your mic and let us know who you'd like to talk to. As I'm taking a look at the screen, I don't. At this time, I will open this up to questions. Please, from the media, please raise your hand. I will call on you and unmute your mic and let us know who you'd like to talk to. As I'm taking a look at the screen, I don't. At this time, I will open this up to. I apologize for the feedback there. It just keeps looping on me. I see KNX has your hand up. Calling you and go ahead with your question. and let
Thank
us
you
know who
very
you'd like
much.
to talk
This is
to.
Mark Ewens at KNOX. I guess the
taking a
question
look
could
at
be
the screen,
from
I
either
don't have
Dr. Gear or Swanson.
At this time, I will open this up to, I apologize for the feedback there. It just keeps snooping on me. I see KNOX has your hand up. Calling you and with your question. And let us know who you'd like to talk
This is
to.
Mark Ewens at KNOX. I guess the question could be from either.
Okay, we're having some technical problems here, everyone. It appears to be looping back. I'm going to try play around with the audio systems here. Everyone, just bear with me. I see KNOX has your hand up. Calling you and with your question. And let us know who you'd like to talk
This is
to.
Mark Ewens at KNOX. I guess the question could be from either.
Okay, we're having some technical problems here, everyone. It appears to be looping back. I'm going to try play around with the audio systems here. Everyone, just bear with me.
This is Mark Ewens at KNOX. I guess the question could be from either.
Okay, we're having some. It appears it's looping through KNOX. I'm sorry about that, Mark, as you had your question, but it appears to be looping through you as we try to get this figured out. Mr. Joe Bowen from the Grand Forks Herald.
Yeah, hey there. This is a question for Mike. So yeah, basically, if I'm remembering correctly, you are urging landlords to be lenient. If so, what does leniency mean to you here in this case?
It means not evicting people that are behind on their rent, being understanding that these are difficult economic times and they'll get better, and there's going to be help available from the federal government and in the forthcoming future. So I would encourage people to be human, to be humane.
Okay, cool. Thank you.
Okay, KNOX, I still see your hand up. I'm going to take another shot at it, okay?
Brad Schmidt with KNOX. Is
Help
that better?
available from the federal government.
I'm sorry, KNOX, I'm still looping through on you guys. We're getting a delay. Any other members of the media who would like to, KNOX, I'm going to open you up again here just to see if it can work through. Okay?
Brad Schmidt with KNOX. Is
Help
that better?
available from the federal government.
I'm sorry, KNOX said I'm making an assumption we're going through the board and it's looping on us. Anyone else with their hand up? I'm trying to get to you, KNOX. Don't you worry. We're going to try one more time.
They
Brad
could
Schmidt
type
with KNOX.
available from the federal government.
No, KNOX, could you do me a quick favor? And can you type your question in the comments? I will ask it, and we will go from there. I apologize with the audio issue from KNOX, but we'll go the long run here. If you wouldn't mind typing in your question in the comments, thank you. Everyone else, please hang tight as we hear the question from KNOX. While that question comes in, I would like to thank everyone for joining. I'm not going to go away just yet, but I would like to thank everyone for joining, as this will probably be our MO for doing news conferences, at least in the near future anyway. We'll be doing it like this. KNOX in the studio. Would you be able to type in your question in the comments? I'm going to try unmute you one last time and see what I get. At least in the near future anyway. No, and there it loops back. So lesson learned. Here we go. This is a question from KNOX. Will there be any interface with the Grand Forks Air Force Base as far as support, medical or non-medical? If so, what do you envision that would be like? This question, if it's all right, I'm not sure who wants to take this one. Maybe we'll make our way around the board. Mayor Brown, first one, interfacing with the Grand Forks Air Force Base.
Well, I think they're an important part of our community, so I think we would want to keep those channels open.
Mr. Phelan, would you like to comment on that at all?
I would say, John, on that question, there's ongoing conversations, and I think that's very important. So that now that we're in this pandemic, the important part is our really positive relationship we have with the Grand Forks Air Force Base, and that's really paying off now with our integration, not only with public health in this specific circumstance, but with Ultra Health System. And I know Debbie and Ultra Health System have been working hand in hand on that. So I would hand it off to them to follow up with what's going on day to day with the Grand Forks Air Force Base.
Okay. Let's start with Deb Swanson on this.
Yes, John. Our team has been in touch with Grand Forks Air Force Base Public Health Office almost daily for the last 10 days or so. We get regular updates from them, and we also provide them with updates. However, I think it's important to remember that their mission is critical to the safety of everyone across the nation. And so they have certain guidelines that they follow to maintain that readiness. So at times, their actions may be more stringent than those that we are asking the public to do in order to maintain their critical workforce. I don't want to speak on their behalf. I think they will probably be able to do that better than I can. But I think one thing to remember, the public have to remember that this is different than other emergencies. When you have pandemic, you have to rely upon your local resources because everyone is affected. And so the only way that we might have support from Grand Forks Air Force Base would be if they could remain mission stable and also provide some support to us. But it is really at our best planning efforts to make sure we have all the resources we need locally here and that we aren't depending on others besides our state and national partners that can enhance our supply or our resources.
Thank you, Deb. Dr. Deere, do you have any comment regarding the Grand Forks Air Force Base?
Command Center has been in contact with them.
I'm sorry, Dr. Deere, I didn't have you unmuted. If you wouldn't mind starting over.
It's all right. I can just echo what the rest of the panel has said. We are in contact with their Incident Command Center on a nearly daily basis. I can't speak to if it's daily or not, but we've been in contact with them. I agree with exactly with what Debbie said, that this is different, given it's a pandemic. And I think that any way any of us can help each other in situations like this, the relationships will just continue to grow, and that will look that we have for our community and our partners.
Thank you, Dr. Deere. Are there any other questions from the media? And again, I apologize to KNOX. If you have any other questions, please use the chat function. As we had some feedback from KNOX. But are there any other questions at this time from the media? Yes. KNOX is raising their hand. We'll try unmute it again. If it doesn't work, please be ready. Please get KNOX to start typing in your question. We'll see how this works.
Schmidt with KNOX. Mark was working on typing in a question. I think we may have gotten the issue taken care of now. Are you there?
Yes. KNOX is raising their hand. We'll try unmute it again. Brad, it's not working again. Please, so we're going to have to please go through the chat function for your question. So we'll hang out here a little bit, KNOX, while you ask that question. I apologize for the issues with the audio. Question in from KNOX. Although unlikely, what mechanisms would be in place to ensure businesses do not attempt to engage in price gouging during this? So I guess Mayor Brown, I'm going to start with you on this one, and then maybe go to Mr. Phelan on that.
Well, we'll continue to respond to citizens if they see they're being gouged. Will certainly complain to City Hall. So we'll just contact through our public information office and we'll keep track of that. And if we see that going on, then we have to deal with it because that's unconscionable in our community.
Mr. Phelan, do you have a comment on this stance as well from a city admin standpoint? So, oh, hold on there, Todd. One second. We'll get you unmuted. Go ahead, Todd.
To what the mayor said, please contact us here at City Hall through the public information, and we will follow up. And if there's required state follow-up, we will follow up with the state of North Dakota. And I think the great thing about our community is we have businesses that don't do this kind of price gouging. So I don't anticipate having any of these concerns, but if we do in some small case, we will follow up. And if we need to leverage state resources, we will do that. But I think the positive note is that we have a great community, and I don't anticipate much of that. We're good neighbors here.
Yeah, the next question appears is to me. It asks, since Mayo Clinic closing up tomorrow, will Altru follow? Mayo Clinic, if you actually look at what's going on, they aren't completely closing. If you read through it, and I'll let you do that, and I won't speak on the behalf of Mayo, but a lot of what's going on in Minnesota has been dictated by their legislators. What I can tell you from an Altru perspective is that we're constantly looking at our clinical operations and surgical operations to make sure that we have the safest venues and avenues for patients to be seen in our community. So that will change hour to hour, day to day, and today's work won't look like it will a week from now. But as this pandemic goes on, you can trust that our command center, our team at Altru, has the community and the patient's best interests at hand. Looking at our clinical operations and surgical operations to make sure that we have the safest venues and avenues for patients to be seen in our community. So that will change hour to hour, day to day, and today.
Hey everybody, it's Joe from the Herald again. I have a viewer question. Is there any update on schools? Does anyone know if they're going to open on Monday? I know none of you work for the district directly, but that was a viewer question submitted.
During our National League of Cities conference phone call this afternoon, it was said that the schools will be closed to the 27th of March.
John, if I could respond to. I think, as the mayor said, I think there'll be more significant discussion going on at the 4 o'clock press briefing with Governor Burgum. And I know we've been also communicating. We talked about a lot of our local government partners, but with Dr. Brenner and his team on trying to coordinate with them too. So I suspect decisions will be made today at 4. And as part of the general community, we'll have to partner with our Grand Forks School District.
All right. As I'm sitting here, I see somebody has connected via phone and have unmuted themselves. Do you have a question?
Yeah, Neil Carlson with iNews. I guess for the mayor, you've kind of laid this out a little bit, but could you be more specific for bar owners and restaurant owners? What's being planned, or is that going to be a state decision?
Well, we're going to follow the lead of the governor. So right now we're anxiously awaiting the 4 p.m. news briefing.
Okay.
Okay, and that also to KNOX, I see your question had the same type of question of what is the time frame. To reiterate what the mayor just said, waiting to hear from the governor at his news briefing at 4 o'clock. this time, as we sit here, I do not I'm taking a quick peek to see if there's other hands raised or any other questions. Does the media have anything else for our panel? One other question we were having here from KNOX, there have been rumors about confirmed cases in Grand Forks. Is that true? Deb Swanson, I'm throwing this one in your court. Go ahead, Deb.
Yes, John, we have heard a number of rumors, and we are always attempting to make sure that we have the most up-to-date and accurate information. There will sometimes be a lag of notification because it's very important that the first people notified by the lab are the provider that sent the test result to the lab, so that that provider can inform the patient. Then our epidemiologist is informed of those results to begin a case investigation. In that meantime, a patient may reveal to friends or family their test results, and we don't always have control over that. So sometimes rumors start. We deal with information that we have from our trusted and reliable sources and recognize that there will sometimes be changes to information. Thus far, we have had a few rumors of cases, and as I said before, I think as a population center, it'll just be a matter of time before we have cases here. It doesn't change what we're doing. It does change information for specific people who may have been exposed. But that's the best answer that I can provide at this time.
Thank you, Deb. I hope that answers your question. Any another one from KNOX. Has there been any discussion about steps moving forward once we are on the other side of this, post-pandemic? There's a question to that. Who on the panel would like to answer that one first? Mr. Phelan. 1 second, Todd, as I get you pulled up here.
John, can you hear me?
Go ahead, Todd.
Yeah, I think even though we're in the midst of the ongoing more emergency response, we're always looking several steps ahead. And certainly once we get to the end of this emergency response, and let's hope it's in a matter of 2 weeks and perhaps longer, but we're always looking at next steps. So that's why we're looking financially, what we need to do. We're looking at service levels of where we're at, and we're looking at what further investments we may need to make in the future. I think it's important to note that, while we go through these challenging times, we're taking advantage of this time so that we can better perfect how we operate from an efficiency and effectiveness point of view from the city of Grand Forks. And I think all of our goal right now is to include all through is that we're better organizations when we're at the end of this, that we have perfected things that we were forced into. And we can look back at these times to say we leveraged some really good out of a really challenging situation or extraordinary situation. And so those are the things that we're working on. And we'll see where things are. It's going to be a significant financial hit. We will have to respond to our community longer term and how to sustain our own local and regional economy. And so we're already thinking of those things while we work in the present tense right now. Thank you, John.
Thank you, Todd. The next question, Mayor Brown, is going to be for you from KNOX. This question is, have there been any discussions between the leadership of Grand Forks and East Grand Forks?
We're in constant communication with Mayor Gander and his staff, and that's why we're trying to do things together as we move forward regarding restaurants and bars and things like that, because we want to have a level playing field. And we're constantly in communication, and we are like one community. So I think it's very important we stay in touch.
And Mayor Brown, while I have you on, just I think this is a good one to wrap up with. There's a lot of fear and concern flying around. Can the mayor or someone give a message of hope before signing off today?
Like I said in my words previously, we're in this together. We'll get through this together. And I think that if we do the proper things with social distancing, washing your hands, coughing in your sleeve, avoiding large groups, we can flatten the curve. We'll have the resources available at Alter to take care of those that are extremely sick, and we'll get through this. I think once we have sunlight and summer, I think we'll be in a better position.
That's a good one to end with. Any other comments from our panelists? Dr. Deere, Deb Swanson, Mayor, or Todd? Anything you'd like to add?
Now I'm gonna go shovel snow.
All right, Mayor. Thank you very much. Thank you, media, for joining here. This is hopefully this worked out okay for your mediums and your recordings and everything that you are trying to do. So with this, pardon me here. Is there any? We'll be doing this again in the future, and we'll be doing it this way. We're always looking to learn and try new things. So any feedback from the media standpoint of how this worked for you, I realize it's not perfect, but this is the world we're in right now, and we'll go forward. So thank you for joining us. Any briefings that may come up in the future will alert you the way we did today, and it'll be very much like this. Sorry, KNOX, for having those audio issues, but the chat function worked pretty well. I hope you got all your questions answered. I will end the meeting now. Thank you for joining us, everyone.